Dr. Ekta Balara. Preterm infants refers to a baby born before gestation period of 37 weeks. Preterm neonates contribute to large chunk of low birth weight, height and head circumference. At birth, normal infant is able to suck from mother's breast, conduct the milk thus obtained to back of mouth and swallow it for 5 to 10 minutes continuously while breathing normally. Oral feeding is a complex task for preterm infants. Unlike full-term infants, most infants born prematurely are not able to begin bottle or breast immediately after birth owing to low muscle tone, immature oromotor control, poor coordination of suck, swallow and breathing. Oromotor stimulation is a scientific sequential measure in which patterned stimulation is provided to perioral and intraoral muscular structures for strengthening them, thus facilitating normal feeding pattern. It will develop sensory motor pathways that affect coordination of sucking, swallowing, and breathing. These neuronal connections are strengthened by repeated transmission of information based on experience and environment. Here we can see interior of mouth cavity, teeth, tongue, sublingual fold, frenulum, ducts, and glands. Nutritive sucking begins with compression of mother's nipple by contraction of orbicularis oris in newborn's lip plus gum chewing by moving jaw. This positive pressure produces expression of food flow towards mouth. During suction, infant generates extraction pressure over a fluid contained in an external reservoir towards oral cavity. Once bolus has formed, liquid is directed towards digestive system without passing through airways. Indications of oromotor stimulation. Preterm neonates born at less than 29 weeks of gestational age and it can be until effective oral feeding is achieved. Neonates showing dysfunctional sucking, swallowing and breathing coordination irrespective of gestational age. Neonates with existing brain damage due to birth asphyxia, intraventricular hemorrhage or other clinical causes. Neonates at risk of being deprived of oral feeding due to various clinical comorbidities, example congenital heart disease, congenital anomalies, etc. Prerequisites for oromotor stimulation. Neonates must be placed in supine or side-lying position. Perform procedure 10 to 20 minutes before feeding. Parents' education regarding therapy and benefits. Continuous monitoring of vitals. Gloved finger should be used during intraoral treatment. Discontinue if baby doesn't tolerate therapy. Example, periods of apnea. Baby seems to be drowsy, crying because of discomfort. Assessment can be done on the basis of sucking reflex and rooting reflex. Stimulus, finger touching or going into child's mouth. Response, turning of head of child in the direction of stimulus and appears as though the child is sucking the object. Present at birth and integrates within 3 to 6 months. Another method is neonatal oromotor assessment scale. Separate 13 characteristic of jaw movements and 13 characteristic of tongue movements into normal, disorganized and dysfunctional gradings. A disorganized suck refers to lack of rhythm of sucking activity, whereas dysfunction refers to the interruption of the feeding process by abnormal movements of jaw and tongue. Traditional method used in oromotor stimulation are ice liquid, nuke brush massage, vibration, facial molding techniques, tapping on cheeks and lips, circular cheek massage, and stretch on lips. A handheld vibrator used on the face is very alerting for some children. Sometimes they want to play by holding it themselves. Other times they respond best if you hold it. You can gradually get the child used to the vibration by touching the child's face with the back of your hand while the vibrator is vibrating in your hand. This way the vibration is not as strong because it is coming through your hand. And the first image shows nuke brush massage. Facial molding massage can be seen in first picture where before meal time, if you can relax your child's cheek, do what is called facial molding. Massage your child's cheek and chin towards a closed mouth position. This can be done with your fingers or a washcloth. The washcloth can be dry or warm and wet. The second image shows hands together taping the cheeks. Traditional method, first circular cheek massage. Second is lip stretch, first on upper lip then on lower lip. Third is lip tapping. Slowly close the lips. Another method is premature infant oromotor intervention. It includes 8 steps: cheek C-stretch, lip roll, lip curl or stretch, gum massage, lateral borders of tongue or cheek, mid-blade of tongue or palate, elicitor suck, and support for non-nutritive sucking. Cheek C stretch. Place a finger inside the cheek and one on the outer cheek. Slide and stretch front to back towards the ear, then down, then back to front. C pattern. Repeat for the other side. It improves range of motion and strength of cheeks and improve lip seal. 2 times to each cheek for 30 seconds. Lip roll. Place a finger on the inside and thumb on outside of upper lip. Move finger in horizontal direction while moving thumb in opposite direction, rolling lip between fingers. On the left side of lip, then repeat on right side. 2 placements. Repeat on lower lip. It improves lip range of motion and seal. 1 time to each lip, given for 30 seconds. Duration. Lip stretch. Lay fingers across lip, slightly compressing tissue. Move tissue horizontally, stretching to one side, then the other. Repeat for bottom lip. It improves lip strength, range of motion, and seal. Lateral border of tongue or cheek. Place finger at the level of molar between the side blade of the tongue and the lower gum. Move the finger towards midline, pushing the tongue towards the midline. Then move the finger back and all the way into the cheek, stretching it. Mid-blade of tongue or palate. Place finger at center of the mouth. Give sustained pressure into the hard palate for 3 seconds. Move the finger down to contact center blade of the tongue. Displace the tongue downwards to form pressure. Move the finger back up to the center of the hard palate. It improves tongue range of motion and strength and improves suck. It should be given 2 times for 30 seconds. Eighth step of PIOMI, support for non-nutritive sucking. Leave finger or pacifier in mouth or place pacifier in mouth and allow sucking. It will improve suck and soft palate activation. It can be given for 2 minutes. Oral motor therapy. Oromotor exercise consists of active exercises, passive exercises, and sensory stimulation. Proper feeding techniques in cerebral palsy patients. Do not try to pull head forward. Put your arm across the back of baby's neck and push shoulder forward as depicted in extreme right picture. Thank you.